Hi, my name's Steve Luby. I'm a professor in infectious diseases, and I get the pleasure of introducing Nina Brooks to you. And I want to do this by just calling out some of the characteristics which I've observed working closely with her over the last 5 years. Nina is committed to justice. You will see this in the problems she has chosen to address, in concern for the health of low-income communities and in concern for the health of women. As a student, Nina has taken an unusual tack on skill building. Rather than focusing on skills that come easily to her, she's intentionally worked to acquire skills she views as useful. She viewed quantitative skills as important and so loaded up on math and statistical classes when she was studying public policy at Duke. When she came to Stanford, she took the economic PhD core. In our monthly one-on-one meetings during the first 2 years, the conversation was dominated by her efforts to slog through this coursework. But you'll see in her presentation how adept she's become with quantitative approaches. And I saw her do this similarly with remote sensing. She's not an expert on remote sensing, not an expert in computer science coding to enable machine learning, but she engaged with Jihan Lee and other students to frame and advance this work. And that's another aspect of her, which she brings to her work of working really well with students. She worked with the computer science students. She also led a group of mechanical engineering graduate students on a visit to India to understand context and help work to develop strategies to improve combustion efficiency in kilns. She's really generous with her time, and she supported the students so the students could do outstanding work. My efforts to improve brick manufacturing in Bangladesh has benefited enormously from Nina's engagement with the work since January in 2017. There's so many ways she's helped, but I would point out 3. She has asked different questions. She's come from a different perspective. She's read different literature, and she's even conducted analysis differently than an epidemiologist would. You'll get the pleasure of hearing about this. Finally, I would note that Nina's been incredibly responsive to critique. Stated differently, she learns a lot from conversations and suggestions. It's been very exciting to watch her develop more and more skills with each year. She's been an outstanding E-IPER PhD student. I'm confident that we'll all enjoy hearing the summary of her work.
Wow, thank you. Thank you so much, Steve, for that introduction. And thank you all for being here today. I'm really excited to present my dissertation work. I came into the E-IPER PhD knowing that I wanted to work at the intersection of environment, health, and international development, but also that I wanted to work on big, important problems where building an evidence base could hopefully have a real impact on people's lives. And that's what drew me to these 2 problems: air pollution and abortion access. This dissertation is the result of that work over the last 5 years or so. And I will do acknowledgements at the end, but right now I wanted to just take a moment and highlight that all of this work has been highly collaborative, and it wouldn't have been possible without my field partners in Bangladesh, specifically the International Center for Diarrheal Disease and Research of Bangladesh and the Child Health Research Foundation, and also some amazing Stanford students that Steve has already mentioned. So my dissertation is structured in 2 parts. The first part includes 2 chapters on the brick manufacturing industry in Bangladesh, where I cover the regulatory environment, air pollution, and health impacts. The second part of my dissertation examines abortion access, which also includes 2 chapters. The first examines a policy which massively expanded abortion access in Israel, and the second studies a case in which access is curtailed. Anyone who knows me knows that I could talk for days about both bricks and abortion policy, but since we only have about 40 minutes or so for my talk today, I won't be able to present everything. So today I'm going to present first my work on the brick industry, drawing from both chapters, and then I will turn to my analysis of the US-Mexico City policy, my 4th chapter. Just to give my 3rd chapter a little bit of light in today's talk, my 3rd chapter is an analysis of a policy in Israel that massively expanded a subsidy that made abortion free for eligible women. In this chapter, along with my co-author, Tom Zohar, but use the policy as a natural experiment to examine the impact of expanded abortion access on fertility and labor market outcomes for women. And so I'm very happy to talk about the project more during the Q&A if there's interest and time, but I just don't have the time today to address it in my main talk. So I'm sure many people here are familiar with this picture taken of San Francisco, or also this one taken. These were taken on September 16th of 2020, when wildfire smoke blocked out the sun, made the air toxic to breathe, and gave the entire Bay Area an eerie orange apocalyptic feel. But as truly destructive and awful as these fires were, imagine if this is what the air looked like on a regular basis. Well, for the people living in the megacities of South Asia, like Delhi, which is shown here, or in Bangladesh, which is where I conducted most of my fieldwork, shown here, this is what the air looks like every winter. And specifically in this picture here, this is what the air looks like to live near the brick kilns that I'll be discussing in my talk. To make things more concrete, here I'm plotting the daily average PM 2.5 from January 2018 up through about a week ago in San Francisco. PM 2.5 is particulate matter with a diameter that is less than 2.5 microns. People always seem to compare this to human hair. So in case that is a useful comparison for you, these particles are around 30 times smaller than the average human hair. Particulate matter is a mixture of solid and liquid particles that do come from natural sources. For example, there's PM 2.5 in the dust over the Sahara Desert. But more importantly, it comes from fossil fuel combustion. And because PM 2.5 is so small, it can be inhaled deep inside the lungs and into the bloodstream, which is why it's so concerning from a public health perspective. And I'll be showing a lot of data and figures with PM 2.5 throughout my talk today. So in this plot, we can see two really drastic spikes. The first one here in 2018, when there was a really bad fire season in California, particularly the Camp Fire, which was raging in the Bay Area. And then again, most recently in the latest fire season, where there were just fires raging everywhere. And in these two cases, the PM 2.5 reached or exceeded 150 micrograms per cubic meter, which is really high. The EPA's daily recommended guideline for maximum daily exposure is 35. Now I've added a line for the same time period for Dhaka, the capital of Bangladesh, which is shown in blue. The concentrations in Dhaka are just dwarf the concentrations in San Francisco. Those peaks that we saw, you can barely see them anymore. And in Dhaka, there's no fires. This is just business as usual, which just really highlights the extreme concentrations that this population is facing. Another thing that I want you all to take away from this figure is that air pollution in Dhaka also has a really strong seasonal pattern. So air pollution is lower in all of these summer and monsoon months, and then it gets substantially worse in the winter. The winter also happens to be the time of year when brick production takes place. But before I get into brick production, I want you to understand why air pollution is so dangerous. So air pollution, and PM 2.5 in particular, is a major cause of death and disease from respiratory illnesses, such as lung cancer, chronic obstructive pulmonary disease, lower respiratory infections, which is mostly pneumonia, and also asthma. But because PM 2.5 is so small and can get into the bloodstream, it's also a major cause of cardiovascular disease. And in fact, the link with cardiovascular disease is the reason why air pollution is the biggest environmental cause of death and disease globally. Air pollution also negatively impacts fetal development and pregnancy outcomes, causing low birth weight and preterm birth, as well as infant mortality. But it's not just health that's directly affected. Research has also found that exposure to air pollution lowers school attendance, test scores, labor supply, and also labor productivity. In Bangladesh, and really across all of South Asia, brick manufacturing is one of the largest sources of air pollution and greenhouse gas emissions. Since bricks are the primary construction material in Bangladesh, the industry is really the backbone of the country's quite rapid development and urbanization that we've seen over the last 2 decades. This is an informal industry dominated by traditional kilns that rely on migrant labor that is also highly exploited. So these workers mold the tens of billions of bricks that are produced in Bangladesh each year by hand, which is what this video is showing. And it's just really quite staggering when you see this, in person, just all of these billions of bricks molded by hand. Then they stack the unfired bricks, which are called green bricks, outside to dry in the sun. And this is a big reason why brick manufacturing is a seasonal operation, since this step would clearly not be possible during the heavy rains of the monsoon. And in fact, in Bangladesh, much of the land on which kilns are built will get completely flooded during the monsoon season. After drying outside, the bricks are then fired inside the kiln with coal. So this man here is a fireman, and he will lift all of these portholes that are shown here and pour in a bit of pulverized coal, and that's what's being stored in these buckets up here. During the brick production season, which runs in Bangladesh from around November to April each year, the bricks are fired 24 hours a day, 7 days a week, and this cycle of molding, stacking, firing, and unstacking continues nonstop during that time. The combustion efficiency of these traditional kilns is really low, which is why they are so highly polluting. And studies suggest that kilns contribute up to 50% of the PM2.5 in Dhaka each winter, and actually 17% of Bangladesh's total annual CO2 emissions, even though they're only running for part of the year. So in my dissertation, I examined 2 questions to inform the policy discussion around brick manufacturing. The first is, to what extent are existing kiln regulations enforced? And hopefully, what can we learn to maybe inspire better enforcement and compliance? And then second, what are the health and environmental consequences for communities living near brick kilns? I will first present my work on the regulatory environment, where I partnered with students in computer science, as Steve mentioned, to develop a machine learning model that identifies brick kilns in satellite imagery, and then I match the locations to geospatial data on regulated entities. Then I'll turn to my study on the consequences of exposure to kilns. So there are many existing regulations that govern where kilns can be established. They mandate that kilns must be at least 1 kilometer from population centers, from schools and health facilities, among other things. They're also banned within 2 kilometers of forest, and also in 3 hill districts, which are located in the Chittagong division of Bangladesh, where there is a more delicate environment, and it's also home to protected indigenous groups. So these regulations are ostensibly there to protect the environment and people from kiln pollution. And I should say there are also a number of other regulations that cover more than just where kilns can be constructed. For example, they also mandate the type of fuel that is used. Wood has been banned in Bangladesh for quite some time. But for the purpose of this analysis, I focus on regulations that can be assessed with geospatial data. But before I could analyze whether kilns were illegally constructed, too close to schools or hospitals, I needed to locate the kilns. So to do this, we used an image detection algorithm that was trained on satellite images. So here are some examples of the imagery that our model saw that contained kilns. So the kiln is located right here in this image and in the bottom right here, although you can also see some edges of kilns that are nearby. The unique shape and color of the kilns is what lends themselves to this type of approach. And just for reference, here are some examples of images that our model saw that did not contain kilns. So the model learns from these images, and then it predicted whether or not new images contained a brick kiln. And then by zeroing in on the pixels that signaled to the model that this image contained a kiln, we're able to identify where within the image the kiln is located. So then we isolate those kiln pixels from the non-kiln pixels and find the centroid, which we took to be the location of the kiln. And then we extracted the precise GPS coordinates. We ran this model on satellite imagery covering all of Bangladesh, which at the spatial resolution we used was about 1.8 million images. And then we produced a database with the locations of all the kilns in the entire country, which comes to just under 7,000 kilns. So this is a satellite map of an area in the southern part of Dhaka. The coordinates generated by our model are shown in yellow. So as you can see, the model does a really good job of locating the kilns. It's often landing right on the center, which is what makes this approach so exciting. Another thing to take away from this picture is how clustered the kilns are. It's actually quite common to see so many kilns so close together, which should make you sort of think back to that picture I showed at the beginning of my talk of all of those chimneys. That, you know, once you see one kiln, it's very common to see more than one. So with these coordinates in hand, I matched the kiln locations to geospatial data on health facilities, schools, railways, forests, protected areas to assess compliance with the kiln regulations. This bar plot is showing the percent of kilns that are constructed within 1, 2, 5, and 10 kilometers of each of these entities. And the dashed vertical line on each of these bars shows the cutoff at which kilns are illegal. So for all of these, it's 1 kilometer, except forests where it's 2. And so what I find is that 9% of kilns are illegally constructed within 1 kilometer of a health facility in violation of the law. But 77% of kilns are constructed within 1 kilometer of a school. Kilns are also constructed too close to railways, forests, protected areas, but there's nothing quite as egregious as the violation of proximity to schools. And so this is really concerning given the effects air pollution can have on children's developing lungs, as well as their academic performance. When I match the kiln locations to data on population distributions, I find that 12% of the population lives within 1 kilometer of a brick kiln, which is over 18 million people. But when I look a bit farther, when I go out to 10 kilometers, I see that 95% of the population lives within 10 kilometers of a kiln. And so that really highlights the limitations of these distance-based regulations in an extremely densely populated country like Bangladesh. There's just not much more space to be pushing out these kilns toward because there are so many people quite literally everywhere. So what are the implications? I presented empirical evidence on pretty minimal enforcement of existing regulations. I have shown how an extremely large proportion of the population lives in close proximity to kilns, and in particular shown how vulnerable populations, school children and people visiting health clinics, are highly exposed to kilns. However, I've also demonstrated a promising low-cost way to identify and monitor non-compliance, which in the hands of NGOs or the government could help to improve enforcement. But returning to my research questions, I now ask, what are the consequences of living near kilns for those tens of millions of people that I just showed live in such close proximity to a kiln? So I answer this question with a field study where I compared air pollution and health outcomes between populations that differed in their exposure to kilns. And I'll be using those kiln locations that I just showed you that we identified with the machine learning model for this purpose. I conducted this fieldwork in Mirzapur, which is a sub-district located around 60 kilometers northwest of Dhaka and is shown here in the map on the right. This is a region where our partners have been working in the community for more than a decade. Specifically, they work in these areas that are shown in orange. Outside of Dhaka, air pollution monitoring is sparse. So we collected our own PM2.5 measurements by placing 18 low-cost pollution sensors in the field and varying the distance to kilns. On the map, the pollution sensors that we placed in the field are shown by those black diamonds. And then all of the kilns mapped by or located by our model are mapped here and shown in red. We also conducted a household survey and an individual survey, which collected health information from around 3,400 individuals across 940 households. And then finally, we did all of this field work across 2 time periods. First, December of 2018 to March 2019, when the kilns are in operation, and then again between May and September of 2019, when production is halted due to the monsoon. I analyzed the effects on PM2.5 and on 3 outcomes related to respiratory health. First is chronic obstructive pulmonary disease, which I analyzed for adults over the age of 40, asthma symptoms for children under 5, and then a general respiratory symptoms health measurement, which I analyzed separately for adults over the age of 18 and children under 5. To motivate my empirical approach, I want to demonstrate first how wind direction has an extremely strong seasonal pattern. So here I'm using wind direction, data on wind direction from a global gridded wind reanalysis data set, covering the same time period as our fieldwork. This is a windrows plot, which shows the frequency counts of wind that's coming from different directions. And so the way to interpret it is the percent of observations that are blowing from a given direction. So as this figure clearly shows, when the kilns are in operation, here on the left, the wind is blowing almost exclusively from the northwest direction. And then when the kilns are off, it flips and it blows from the southeast as the prevailing wind direction. And so this difference is how I will identify which households are most exposed to pollution coming from kilns. So I'll walk through how I use this wind direction combined with proximity to kilns to define exposure. So I started with the GPS locations of all of the kilns, along with the GPS locations of the PM monitors and also the households, which are going to be jointly represented by this little house here. I calculated the pairwise distance between all kilns and each monitor or household, which are represented here by those dashed lines. And then I drew a 2 kilometer buffer around each monitor or household and identified whether kilns fell into that buffer. So the 2 kilometers is motivated by the government regulations, as we just saw. It's sort of the upper bound of those distance cutoffs for where kilns can be built, but I did do this for many other cutoffs. Then I identify whether each PM monitor or household is downwind from at least one kiln within this 2 kilometer cutoff. And so this is what I mean when I say the PM monitor or the household is exposed. Then I use this exposure measure in a difference in difference approach that quantifies the effect of greater exposure to brick kilns during the brick season on daily average PM 2.5 and those 3 health outcomes. So intuitively, this is taking the difference in outcomes for the exposed households during the brick season, which is shown on the left, and the off season shown on the right. Then I take that same difference for the non-exposed households, again with the brick season on the left and the off season on the right. And so what I mean by not exposed is they're not downwind from any kiln within 2 kilometers, as shown here. And then I'll take the difference between those differences, which is how it gets the name, which is the effect of greater exposure to brick kilns during the brick production season. Formally, I'll estimate this difference in difference with this regression. So the exposure variable that I just defined is captured by this first term. The second term here is an indicator that represents the brick season. And then that difference in difference is captured by this interaction term here. And this beta 3 is capturing the effect. And I'll be showing this beta 3 coefficient on the upcoming slides. For PM 2.5, I use a linear regression, and I control for a range of meteorological and geographic factors that affect pollution dispersion. For the health outcomes, which are all binary, I estimate a logistic regression while controlling for demographic, socioeconomic, and geographic variables, and I'll present the results as odds ratios. For the health outcomes, I also include village fixed effects, which are represented by this delta V term here. And so that means that I'm effectively making comparisons between exposed and unexposed households that live in the same village. So the only difference is that some of them are downwind from a kiln within 2 kilometers and others are not. So I find that the exposed areas, that is those areas 2 kilometers downwind from a kiln, experienced 72.3 micrograms per cubic meter higher PM 2.5 during the brick production season compared to areas that were not downwind from a kiln. The 95% confidence interval shown here in parentheses on the right indicates that this result is statistically significant. But importantly, the magnitude of the effect is also quite large. So if you think back to those plots that I showed at the very beginning, the spike in PM 2.5 that San Francisco saw during the fire season was 150. So this is about half of that. Another way to think about this magnitude is that it represents a 137% increase relative to the average PM 2.5 recorded by unexposed monitors during the off season, which was 53. I find that this translates into worse health outcomes. So here I'm plotting the odds ratios for that interaction term that I showed a few slides back. An odds ratio of 1 implies that there's no difference in the odds of an outcome between the exposed and unexposed groups. Thus, this dashed vertical line here is at 1, and any confidence interval that crosses that line means that I statistically cannot distinguish the estimated odds ratio from a null effect. So my results show that exposed adults have 2.2 times higher odds of experiencing COPD symptoms during the brick production season. I also find 4.2 times higher odds of experiencing respiratory symptoms among exposed adults during the brick production season, which is a really big effect. For the children, while the coefficients do suggest greater odds of both respiratory symptoms and asthma symptoms, the confidence intervals are really large. So statistically, I can't really distinguish these from a null effect. To increase the confidence that these effects are due to pollution from kilns and not some other confounding effect, I ran several placebo tests. So the first is a check on how I define exposure. So here I'm defining exposure as monitors that are upwind from the kiln rather than downwind. So given the prevailing wind direction that I showed, we would not expect these monitors to be getting much kiln pollution during the brick season because the wind would be taking it the opposite direction. So as expected, I find a small and statistically insignificant effect when the monitors are upwind from the kilns. Then I estimated that same difference in difference specification on 5 outcomes that reflect alternative hypotheses. For example, maybe people who live downwind from kilns are more aware of pollution during the brick season, and maybe they do something to avoid it. While that sort of bias would actually lead me to underestimate the negative health effects of living near kilns, I find no evidence in these first 2 rows that people who live downwind from kilns are more aware of pollution or are taking any action to avoid it. Then I tested whether people who live downwind from kilns are simply more likely to work at a kiln, which if this were true, it would mean that I might just be capturing a difference in occupational exposure to air pollution rather than the effect of living near kilns. And although I do find greater odds of having worked on a kiln during the brick season, this is not statistically significant. Then lastly, I checked whether people who are more exposed to kilns were more likely to experience other non-respiratory health effects during the brick season. And I do this for both adults and for children. And I find no evidence of this. And so this helps to rule out the hypothesis that people living downwind from kilns might just be less healthy due to occupational sorting or other reasons that have nothing to do with kilns. Sorry, residential sorting and reasons that have nothing to do with kilns. So combined, these placebo tests suggest that the mechanism I'm proposing, that people who live downwind from kilns have worse health outcomes due to kiln pollution, is indeed what is driving the effect. So I find that people more exposed to kilns experienced significantly higher air pollution and were more likely to have COPD and respiratory symptoms than people who don't live downwind from kilns. These effects were quite large in magnitude, particularly for adults, and they were also robust to alternative specifications and the inclusion of many controls. And although no study is without limitations, the inclusion of fixed effects in the health outcomes really strengthens that design. The 1 kilometer cutoff that the government currently uses for banning kilns from human settlements and schools and health facilities is insufficient to protect population health. And moreover, as I've shown, those existing regulations are not even enforced. So a very large portion of the population is thus highly exposed to kiln pollution. Given demand for bricks is projected to grow in the coming years, and taken together with the population density of Bangladesh, it's not really possible to move kilns far enough away from human populations to reduce the air pollution exposure, while still supplying bricks for the entire country. Thus, brick manufacturing needs to be cleaned up by improving the efficiency of combustion, which is actually quite possible with a number of low-cost approaches. And as Steve alluded to, that's where we're taking this work going forward. So returning to my dissertation outline, I've shown you how kiln regulations in Bangladesh are not enforced and what the consequences are for people living nearby. So now I'll turn to the other part of my dissertation focused on abortion access, and I'll present my work on the Mexico City policy. Around the world, childbirth remains extremely dangerous for many women. Unsafe abortion and associated complications is a leading cause of maternal mortality. And unsafe abortion occurs disproportionately in low and middle income countries. Access to modern contraceptives, such as the birth control pill, IUDs, implants, injectables, is a low-cost way to reduce maternal mortality. By giving women the ability to choose when and under what circumstances to get pregnant, it reduces unintended pregnancies and in particular reduces risky pregnancies, as well as avoids the need for unsafe abortion. Contraceptive access has also been linked to improved child survival and child health by allowing families to better space their pregnancies and invest more in their children. But despite the many positive benefits of modern contraceptives, in developing countries, there is still a large unmet need for family planning. And moreover, in countries that depend on foreign aid for family planning, access to contraceptives is dictated by US domestic abortion politics. Specifically, it depends on the Mexico City policy. So the Mexico City policy was first announced by the Reagan administration in 1984 at the Second International Conference on Population, which was held in Mexico City, and is the reason why this policy has what is otherwise a completely uninformative name. This is the official language of the policy. It requires that NGOs certify that they will not perform or promote abortion as a method of family planning as a precondition for receiving US aid, even if those organizations were to use funds from other non-US sources for abortion-related activities. Organizations face a choice when the policy is in effect. They can sign on to the policy and continue to receive US funds, or they refuse and they forego that funding. Typically, the biggest players in international family planning programs, like the International Planned Parenthood Federation and Marie Stopes International, refuse to sign on to the policy because abortion access is a core part of their mission. And as a result, they lose tens and sometimes up to $100 million of foreign aid from the US when the policy is in effect. This is a quote from a village health worker in Uganda, which highlights the potential consequences faced by on-the-ground organizations when the policy is in effect. She says, "Most of the contraceptives we provide are provided by Reproductive Health Uganda. Women will walk for many miles to a health clinic and find that they cannot provide the services. So if we are unable to continue this service, many women will lose out." The policy is enacted by executive order, typically in the first week of a new presidential administration that takes over from a president of the opposing party. So Bill Clinton overturned the policy when he took over after George H.W. Bush in 1993, and then George W. Bush reinstated the policy in 2001. Barack Obama overturned it again in 2009 during his first week in office, and then Trump reinstated the policy in 2017. But also importantly, the Trump administration expanded the policy so that the funding restrictions apply to all US global health aid rather than only aid for family planning, subjecting a much larger amount of money to the policy's restrictions. And so I fully expect that the Biden administration will rescind this shortly after he is inaugurated, as he's already committed to. The on and off nature of this policy, while tumultuous for organizations, is what allows us as researchers to study its impacts. For this analysis, I combined a number of different sources of data. So first, I used the demographic and health survey data for 26 different sub-Saharan African countries. I focus on sub-Saharan Africa because the region is highly dependent on foreign aid for global health programs and thus very vulnerable to the policy's funding restrictions. These are individual level survey data that allow me to identify abortions, pregnancies, and contraceptive use. However, my primary source of contraceptive information comes from the World Contraceptive Use Database, which aggregates a number of different data sources on contraceptive use and is available at the country year level. Then I use data on foreign aid flows, which is how I will define vulnerability to the policy, as I'll explain in a moment. And then finally, I'll add country characteristics from the World Bank's World Development Indicators dataset to use as control variables in my regression models. I combine all of these data sources to construct a dataset that spans from 1995 to 2014 and covers 3 presidential administrations. To examine the impact of the policy, I first identified which countries were most exposed to the policy. That is, who is most vulnerable to the funding restrictions. So I used data on bilateral aid flows for family planning from the US to each country in our data set. And I calculated the average per capita aid for each country, when the policy was not in effect, and I used the time period under the Obama administration for this purpose. Then I classified countries as high exposure if they received more than the median per capita aid, and low exposure if they received less than the median. And so this captures how much they have to lose, in a sense, when the policy is in effect. To quantify the impact of the policy, I am again going to use a difference in difference approach. As before, this is making a relative comparison. I'm comparing outcomes between women living in countries more and less reliant on US aid across periods when the policy is both active and inactive. That difference in difference is again captured by the interaction term here, and the coefficient beta is what I'll be plotting on the coming slides. The strength of this design is that it includes periods when the policy is in effect under Bush and also when it's not under Clinton and Obama. I analyzed 3 related outcomes: abortion, pregnancy, and contraceptive prevalence, and include a number of controls that affect fertility decisions. And then lastly, I also include country and year fixed effects, which help to isolate the policy's effects from background trends and other confounding factors that affect fertility and reproductive decisions. So I find that when the policy is in effect, the abortion rate rises by 40%. So an increase, and quite a large one. These funding restrictions imply an intended goal to reduce abortion. So how could this policy result in an increase? Well, if the policy curtails the operation of organizations that provide comprehensive family planning services, it may also limit the supply of modern contraceptives, as the village health worker in Uganda alluded to. And this could result in more pregnancies, some of which end in abortion. This is exactly what I find in the data. There's a decrease in modern contraceptive prevalence by 14% and an increase in pregnancies by 12%. And so all of these results should be interpreted as the effect in countries more reliant on US aid when the policy is in effect. So moreover, the timing of these changes coincides with changes in the policy. Here I'm showing the residuals after running a regression of abortion on country and year fixed effects and all of the individual level controls from my regression. Then I summarize them by exposure to the policy and year, and I'm fitting a smooth line within each group. So here, when the policy is off during the Clinton years, we see relatively lower abortion rate in the countries more reliant on US aid. So it's shown in orange, the high exposure group. So it's relatively lower than the blue line. Then when Bush reinstates the policy, we see the lines flip, and there's a relatively higher abortion rate in the high exposure countries. Then, when Obama rescinds the policy, we see the lines flip again. So not only does this increase our confidence that these changes are being driven by changes in the policy, it also importantly shows that the effects of the policy are reversible. So ultimately, I find large effects of the US-Mexico City policy. I see an increase in the abortion rate by 40%, and I see a corresponding reduction in contraceptive prevalence and an increase in pregnancies. Given the organizations that are most affected by the policy are the same ones that would be providing safe abortion services, it's reasonable to expect that many of these excess abortions are in fact unsafe abortions, which has pretty drastic implications for maternal health, although that was not something we were able to directly test in this analysis. This is presumably an unintended effect of the policy, given its stated goal. But the good news is that my findings suggest that the negative impacts are reversible and that increasing the supply of and access to modern contraceptives can be effective at reducing the need for abortion. Importantly, however, my findings only cover the time period from Clinton to Obama. The Trump reinstatement of the Mexico City policy, which is known as PLIGA, the Protecting Life in Global Health Assistance Act, subjects all US global health aid to the policy. And so while the US is the largest donor in terms of family planning, giving out around $600 million in aid each year, the total global health aid budget is more than $7 billion, which puts many more health services at risk of disruption when the policy is in effect. And this is actually where I plan to take this work going forward. So across these 2 parts of my dissertation, I have empirically documented a range of regulatory failures and unintended policy consequences. But my work also highlights opportunities for evidence-based strategies to improve health outcomes by both reducing kiln pollution and increasing access to modern contraceptives. Looking forward, I plan to expand on this body of work in several ways. So first, on my brick kiln work, I'd like to extend the machine learning approach to cover more time periods and other countries in South Asia, where bricks are made similarly, ideally pushing toward a regional database that documents the expansion of kilns over time and space that can be used by civil society, governments, and researchers. I'm also working to make kilns more energy efficient to reduce kiln pollution and greenhouse gases. I've been working with my advisors, Steve and Grant, and partners in Bangladesh and India to fundraise for a project that will deliver a kiln upgrade intervention and conduct an evaluation, with the longer term goal of scaling up a successful intervention across Bangladesh. On the reproductive health side, I plan to extend the work on the Mexico City policy to Trump's FLAGA once sufficient data become available. Given sexual and reproductive health services have become really integrated over the last few decades, there's reason to expect that the impacts of the expansion could be really harmful to HIV programs and HIV/AIDS related outcomes in sub-Saharan Africa. So I hope to explore that among other outcomes. And then finally, I'm really interested in integrating my two bodies of work on air pollution and reproductive health and examine relationships between environmental factors and air pollution in particular and reproductive health outcomes, with the ultimate goal of improving our understanding of how environmental factors impact reproductive health. And thank you, and I look forward to your questions.
Thank you so much, Nina. That was a wonderful presentation. So I'm going to move into the Q&A portion. Let's see, and we have two questions from Laura. Laura, would you like to ask your questions?
Sure. Thank you so much, Nina. It was an excellent presentation of really fantastic work that is multidisciplinary and shows field skills and computer skills and large data set skills. And so it's really great to see all of this. I had two questions. One on the PM side, you mentioned that the living within 2 kilometers of a brick kiln, people were exposed to 2.9 times more PM than the WHO limit. And I was wondering if PM 2.5 exposure, the health effects of PM 2.5 exposure is linear, or if that's well understood. And then my second question was if you have successfully convinced anyone who supports the Mexico City policy that it's not achieving their aims.
Thank you. So on PM 2.5, so yeah, there's these studies that sort of do this integrated exposure response curve estimates, and depending on the health outcome, most of the evidence seems to suggest it's either linear, and this is, yeah, it's for PM 2.5, either linear or a little bit logarithmic. But the problem is that most of those studies are based on sort of really good health outcomes analysis that's done in the US. So it's not really clear if it's reliable at the really high end of the PM 2.5 distribution that we're looking at in, in settings like Bangladesh and India. And the way they get the numbers there is largely extrapolated from some indoor cooking studies and also from secondhand smoke studies. And so the exposure pathways might be a bit different, and the content of the smoke is also different between smoking versus burning coal, also burning trash and all the other stuff that gets thrown into kilns or is present in ambient pollution. So I think whether it's linear or logarithmic is definitely still not super well understood at the high levels of the air pollution distribution. But I mean, there is a lot more work on that now, especially stuff that is coming out of China, where there's obviously high air pollution concentrations, and some other studies, including what Marshall and Iran have done in sub-Saharan Africa. And then on the Mexico City policy, so I was in DC, I guess last October, for a workshop that was organized by definitely proponents of or advocates against the Mexico City policy. They call it the global gag rule, and it was organized by a number of different organizations, including the Open Society Foundations, and it was supposed to be presenting research on the Mexico City policy for policymakers, and but it obviously comes from a certain bent. And then we had some meetings on the Hill But it was all with, Democrat congressional staffers and Senate staffers. So I'm not sure if we're really convincing anyone there that didn't already sort of oppose the policy. But they did say, they all are based in DC and talk to people on the policy side quite often. And they said after this paper came out last summer that they were starting to get some more heads turning from Republicans and people sort of really starting to push them on and say, if you care about, reducing abortion, this is not achieving it. Obviously the risk is then they say, okay, let's figure out a better way to reduce access to abortion. So that's definitely a downside, potentially.
Thanks.
Wonderful. Thank you, Laura. So we have a question from an anonymous attendee. So I will read this question. And first of all, it says, fantastic presentation, Nina. Do you have any thoughts on how regulators, policymakers in Bangladesh might respond to your findings on how the kilns are too close to schools and hospitals? So that's one question. And why do you think they weren't able to find significant health effects on children despite there being so many kilns close to schools?
So on the regulator side, this is definitely our grand hope that we can engage regulators. The problem with most of the regulations these distance-based ones, and also there's a fair amount of regulations on kiln type, which we actually were able to assess a bit with the study, and I didn't present those results today, but an older, dirtier type is banned. And the problem, they're easier for sort of, constrained regulatory agencies to sort of monitor. And although they're not really enforcing, but you can sort of tell, is a school too close or not, although they're not really enforcing it. But I would be a proponent of sort of more emissions-based regulations that would allow, actually control what's coming out of the stacks much more easily, because we just can't, Bangladesh is going to continue to grow and bricks are going to continue to be central to that. And so moving them far away is just never going to work. And then on top of that, bricks are heavy and difficult to transport. And so there's sort of other structural and economic factors that suggest that a distributed network of many kilns might be good at that, especially given other infrastructure constraints in Bangladesh. So I would just advocate much more towards lowering emissions in general and sort of moving away from these so that, if they're just cleaner, then it's okay if it's, a couple kilometers from certain things. And then the health outcomes for children. Yeah, so we weren't assessing, so I was looking at children under 5 for those. So most of those children are not quite yet in school, although the schools, the schools are also close to where people live. So they're sort of pretty evenly distributed. I think the main problem was a sample size issue. For both of those, we just didn't really have enough children in our sample to detect robust effects. And then specifically for asthma, we were using a questionnaire-based tool that has been internationally validated, although probably could do with some more validation and perhaps improvements in settings like ours. It asked about wheezing, and we had a video to show participants, but I think it was just a really unfamiliar concept for most of our study participants. And as a result, the asthma prevalence that we detected just across the whole sample was incredibly low. So then on top of that, to detect further differences, by distance to kiln and by season, we would have needed a really large sample, which we just didn't have. But definitely better work could be done to improve the sort of tools to assess these in low income and resource constrained settings.
Great, thank you, Nina. I also want to open this up to the other committee members if you have any questions right now during Q&A. Okay. And if there aren't any other questions from the audience, we can move into acknowledgements.
I have so many people who I need to thank that made all of this possible. So first, just definitely want to extend thanks and gratitude to the many funders who made this work possible. And I feel very fortunate to have done my PhD at Stanford and in E-IPER in particular, where so many resources are available. Then I want to give a huge thanks to all of my research collaborators. First, the many people involved in the fieldwork that we did in Mirzapur, from the International Center for Diarrheal Disease and Research of Bangladesh and the Child Health Research Foundation. In particular, I want to thank the data collectors, which this is our team of data collectors over here on the far left, who just tirelessly visited household after household, even visiting some by boat during the monsoon, as well as Shamim and Shampa from CHRF, who helped to supervise the fieldwork. And then, of course, just a big thank you to all of the participants who graciously gave us their time and participated in our study. Then I want to give a big thanks to Debashish, who is both here and here, from ICDDRB, who has just been my partner in all things Burke related from day one. Also my culinary guide in Dhaka, always willing to take a long lunch break and fight the traffic all the way to Old Dhaka for some biryani. And he's welcomed me into his home and made working in Bangladesh just a really wonderful experience. And then I want to thank Alex Yu over here on the right, who helped design and implement so much of this work. And I don't think I would have survived the many days of spending 6+ hours in traffic traveling to and from Mirzapur, trying to come up with the perfect acronym for our project without such an excellent research partner and friend. I also want to thank Jihyun Lee, who's here on the left, and Fahim on the right, two amazing computer science students who collaborated with me on the machine learning algorithm. Jihan in particular, who I don't think she expected to spend the next 3 or so years of her life working on a brick kiln identification algorithm when she signed up for CS325B. But it's just been amazing to work with both of them. And I think they have mentored me as much as I've mentored them throughout this journey. And then finally, I need to thank Tom Zohar, my co-author and collaborator on the Israel project, which I obviously didn't get a chance to talk about today, but also my best friend, throughout this crazy PhD journey, from barely surviving that first year econ PhD classes together that Steve talked about, to being roommates, to spending just countless hours in the research room in the Central Bureau of Statistics in Tel Aviv, but also sharing some nice meals in Tel Aviv. I didn't have any pictures of the research room, so this will have to suffice. There was just no better person to have shared that PhD experience with. So I'm not done, so many more people. Thank you, Gabrielle, for chairing today. Of course, it would not have been possible without you. Steve, so thank you so much for your mentorship throughout the PhD, and also the trust that you placed in me. I think when I decided to spend the first 2 years of the PhD over at the econ department, you were just very supportive and trusted that that was the right call. You also entrusted all of the field work for our project in Mirzapur to me, which really helped me to grow as a researcher. And I've learned so much from your approach, first and foremost, which you even just reiterated last week when we met, is ask good questions. You have to focus on that first, but also just really focused on the practical aspects of doing research. My natural inclination to maybe freak out over every last detail that wasn't going quite right with the field work, which was many details. And you were always there to say, yeah, of course, everything is going wrong. Of course it's going wrong, but that's just what happens when you do this type of work. And Grant, I have just really valued your honest advice and guidance throughout the PhD. Even before I started, I remember talking to you about the pros and cons of an interdisciplinary program. And you said something along the lines of, look, I'm not here to recruit you to come to Stanford. I just want you to be making the best decision for you. And that might not be Stanford. I think it was, but you've just continued to be a source of just honest advice and incredibly supportive and available throughout the PhD. I've just enjoyed working with you and TAing for you, and hope to continue working with you in the future. Eran, when we first started working on the Mexico City paper together, since then, you've just been an incredible mentor. I remember walking into meetings to discuss some coding issue with the paper, and we'd end up talking about my plans for quals, which was just great to have that type of support. And speaking of coding, I always appreciated your interest and willingness to get into the weeds with me on all of the work and just nerd out over coding and data questions with me. Marshall, I really appreciate you formally joining the committee here at the end. But well before you were on my committee, you were always available to discuss research questions. In particular, help me think about strategies for analyzing all of this pollution data. And I've also really appreciated your guidance and support to help push this machine learning paper through, and hope to look forward to more collaborations in the future. So a big thanks to all the E-IPER leadership and staff, and especially Anne-Marie and Gabby, who just do so much on the back end to make everything run so smoothly. So many friends and support networks at Stanford to thank. First, just my cohort of 7 incredible women, and now their partners and their children, who just continuously impress me so much, and I'm so lucky to have been a part of all this. And just, also the entire E-IPER student community is an incredible source of support. Then I also want to thank my adopted econ cohort. Without them, I quite literally would not have survived the first year, but they also made the subsequent years so much more fun than I really ever could have expected. And then a big thanks to the Luby lab, and also Jill Mueller, the research administrator of the Luby lab, for just making everything run so smoothly for us. Then a big thanks to friends and family from all over, but my mother and my brother Mark especially for supporting me, and especially for my father. And then lastly, thank you to Emmerich, my partner, my fiance, who has been with me every step of the way through this process with just unwavering support, who has listened to me ramble endlessly about bricks and abortion, but is always ready to hear more, and has pushed me to be a better researcher, but more importantly, has pushed me to relax, to have fun, and be much less of a workaholic than I am naturally inclined to be. So thank you to everyone.